Okay, great. Sorry, a little bit of a technical delay. Um, so I was trying to actually share my screen because I have a PowerPoint presentation to make it easier. Um, Let me bring the PowerPoint up, and if you guys can't see it, then I'll try to make this available because there's some stuff on it that it's a lot easier to see than for me to just keep talking about it. All right. Okay, let me see. That's the same one. Okay, we'll figure that out. I'm sorry about the delay and some of the confusion and stuff. I know a lot of people are already in the on the webinar, so I will start with the presentation, and you guys can ask me any questions you want on the chat, and I'll definitely get to answer all of them by the end of the session as well. And I just wanted to give you guys a little bit of background about myself and how I got involved with cannabis and everything. By the way, I'm Dr. Pouya Mohajer. I'm an anesthesiologist and a board-certified pain physician. I did my anesthesia training in Chicago, and right after that, I ended up going to Boston to do my fellowship. And when I was in Boston, when we were doing the clinical rotations, I just noticed that all these patients were on just such high dose opiates. And this is 2003, 2004. So it was like pretty much at the peak of the opiate crisis, which continues to this day. And I always thought to myself, there's got to be a better way to treat pain and just to give everyone opiates. So when I finished in 2004, I came to Las Vegas and I opened my practice here. So from that point on, I was always been pretty strict with narcotics and been open to other modalities, try to help patients with their pain. And when I started out, I had a lot of cancer patients, and when I was talking to them, they were telling me how they were using cannabis to help them with their pain and some of the other ailments, especially nausea and vomiting that was associated with their chemotherapy. Back then, I don't know who's from Vegas and has been there for this long. Vegas has already, or Nevada had passed the medical marijuana legislature, but there was no dispensaries or anything like that. It was mostly co-ops. And unfortunately, back then, none of these patients knew how to grow their own plants. So they kind of relied on these co-ops. And some of these co-ops actually were breeding plants that were quite high in THC. So not every patient was able to get the type of quote unquote medicine that they needed from these plants. So when the legislature got passed to approve the dispensaries, and I think it was 2016 or 17, there was a great opportunity to actually have this as a medicine for people that need it. So that's when I actually became involved with the cannabis business, and ever since then, I've been involved with it, trying to see how we can improve access to patients, provide them with specific medication that's kind of like what actually we prescribe as physicians. Currently, I'm actually trying to work on a research project to have cannabis, a specific type of cannabis used for opiate replacement therapy. So hopefully that's going to be getting off the ground soon, and I'm hoping to use a lot of my own patients in the clinic to help with this research project. Actually, I just got a note that they can't hear me. Can you guys still hear me? I know we're playing with the settings a little bit, try to share my screen. Okay, thank you. Maybe it's just that one person. Okay. Anyway, so back to, so fast forward to now, and so my clinic is going to be involved in some research projects in order to see if we can do some cannabis replacement for opiates. I'm just reading some people's comments here that they're trying to help me with the with the PowerPoint presentation, so I appreciate that. I know last time we had a little bit of a problem, and I had to switch to this platform, so I guess we're still having some issues. But I promise by the next time, I think it'll be much better. So I know you guys can't see my screen, but I will make sure that this is available just like last time. And again, for that, the way I was explaining about my involvement, I'm also the chief medical officer for Nuveda, which is a company that is involved in the cannabis business. So we have several licenses, and that's how it's allowed me to be intimately involved and try to see if we can bring some medicine to the forefront of research. We will go over some topics in this webinar. I want to start out with a little bit of a background on the plant and the nomenclature that people use, especially the different type of strains and the names that it's coined by usually the growers. A little bit of background on cannabis research and why it's so stagnant at the moment and what the obstacles are. Also what the FDA is doing. We'll discuss a little bit about the pharmacology. I won't go into too much in depth in that. We talked about a little bit of that in the last webinar. And then I have a list of about 15 strains that I was going to go over especially since the talk of the webinar is strains. So I just want to make sure that we have a few of those in there and hopefully answer some questions that people have about specific type of ailments that they're trying to use this for, and we move forward from there. So again, I like this to be interactive, and I think we'll get all the quirks figured out by the next time. But in the meantime, obviously, I want to be able to be available to answer questions as well. So I'll definitely answer all the questions by the end of the webinar. So there's two main strains. I'm sure a lot of people already know this. It's the cannabis sativa and the cannabis indica. There's a third strain to the ruderalis, but most of the plants that are in use today comes from either the sativa or the indica. Traditionally, people think about the sativa more of a cannabis that they take during the day. It has more cerebral effects, and then the indica is more of a, in the evening, people have more of a sedative effect on it. And then obviously the hybrid. So the hybrid has made such a huge impact on the whole cannabis industry. And think about a hybrid as you take a combination of either the indica or the sativa, and then you take specific portions of each, and then you breed it until you get to a portion that the desired effects are there. Where did all these crazy variety names come from? So a lot of them have to do with the grower that actually initiated it. So they kind of like to name their own babies. Sometimes it reflects the specific traits of the plant, such as the smell, color, taste, or where it actually came from, like the origin. So you could have pure sativa, pure indica, or you could have any combination in between. So we'll definitely go over a few of those at the end when I go specifically to the strains themselves. Marketing has obviously have a huge influence on the nomenclature of these cannabis strains. The one problem is that there might be a significant difference in the composition or what the cannabis plant is made of. And this could be frustrating for the patients because they don't know if what strain they buy here is same as the strain they bought in California or Arizona. And this is especially difficult for a clinician like myself, is that if I have to make some recommendations, is that, okay, what is actually in this plant? So the good thing about Nevada is that we have very strict laws that makes testing mandatory. And even a lot of the laboratories have started to use the profile in addition to the percent of THC, CBD, or other components of the cannabinoids in the flower, in their profiles, in addition to terpenes as well, which gives it the plants the aroma. So now, as research is being conducted, more and more information is being available to the patients and to see what actually is in this plant. So that definitely helps the patients as well as the as well as the physicians that want to be recommending this. Because as physicians, I mean, we don't know what's in these plants other than what's actually been published and what works and what doesn't work. You know, it's much different than the traditional pharmaceutical meds that we've been prescribing. So again, just to reiterate, now with the testing, we know what exactly the ratio of the components are, how much THC and CBD, and how much of the other components are, such as the terpenes and stuff that I was mentioning. Let's go to cannabis research. So what is the biggest problem with the lack of research in cannabis? And that's due to the classification of cannabis itself as being a Schedule 1 drug under the DEA. So when it's a Schedule 1, they said there's no obvious medical benefit to it. So that's the classification of it. So you have to get a special registration from the DEA in order to do any type of research. And there's a lot of government red tape that makes it very difficult to do research. The cannabis that you actually can use for research, it comes from one location. It's actually University of Mississippi, and they only have 3 types of marijuana that they actually supply researchers with. One is it's actually a cigarette, which is rolled THC at 6%. And just imagine, like, some people that don't like to smoke, they don't want to participate in some research that you only have to smoke. And then they also have 2 extracts. One has low THC and high CBD, and then the other one has low CBD and high THC. So there's some options there. Unfortunately, the way they make it, the terpenes get destroyed in the drying process. And a lot of researchers have complained about the composition and the quality of the cannabis that they actually get from University of Mississippi. And a lot of people say this is not the real world marijuana that people are using, or the cannabis that they're using. So to this date, there has not been any research on any of these strains that we're going to discuss. Because it's not allowed, and that's the biggest problem. So hopefully in the future there's going to be some changes made here. There's a lot of people that do want to see a change, so I think there's still a lot of push in Congress as well, and to try to see if we can change this as well. There are some studies, there are some research in CBD, so that's a little bit different than THC research. Now, most of the information that we do get from these strains are anecdotal. They're based on the patient's response, and thank God for the internet, because that's allowed people to actually give their own reviews and give their own experiences with these. And then obviously the more people discuss these different strains and how it affects them and what they're using it for, it allows at least to have a lot more anecdotal evidence versus scientific evidence. But even as clinicians, we definitely need some scientific evidence, because it's going to be very hard to change people's minds into accepting cannabis as a medicine, especially physicians, that are a little bit more conservative. So everyone's always looking for evidence, which is a good thing. So if we can provide that, I think life would be a lot easier for a lot of people. Currently, there are 4 medicines that have been approved by the FDA that comes from the cannabis plant. One is a pure CBD that's used for seizures. There's 2 other ones. There are drobananol, one is Marinol, and one is Syndros, and those are actually synthetic THC. One's a capsule, one is an oral solution that we actually can prescribe, and those are usually prescribed for people that have weight loss or significant wasting due to HIV or AIDS patients, and also nausea and vomiting that's associated with chemotherapy. The pharmacology, I will not go into too much, but what I want to discuss is that how people use the cannabis. Most people do smoke it. There's also the vaporization, which burns it at a lower temperature. So technically, you probably don't get all the chemicals that you get from a pure burn versus a vaporization. As physicians, we tend to try to shy away from the smoking aspect of it, and there's other modes of it available, like the oral ones, such as gummies and stuff. With the orals, we have to be careful. There's a long half-life and long onset of duration. It could be anywhere from an hour to a couple of hours. So hopefully, there's a old saying, like, start slow and go slow. It's like, if you take some gummies, especially the new patients that have not had marijuana in the past, and then you definitely have to wait a bit before you take more, because you don't want to really get the effects later on. As far as the clinical effects, it's pretty much well tolerated. People don't complain of much constipation. It can help with some pain, can improve some sleep, can improve appetite. It does work synergistically with opiates. That means that it actually can help people cut down on their opiates. I've seen in my own practice that patients that do use cannabis, and their opiate intake does decrease. Initially, when this was passed, obviously we always do urine drug screens, and a lot of places were firing their patients because they came up positive for marijuana, and we never did that before. And I always told the patients, is like, it's obviously it's not for everyone, but if it's actually helping you to cut down on your medication, then I think it's a positive thing versus just taking pure opiates, which have a lot more side effects. Now, there's obviously adverse effects that some people do report, and it's been in the literature as well. Some people have some recent memory impairment. You could have some decreased muscle strength. You could have slow reaction times. So especially people that want to drive, you got to be careful. Obviously, we don't want you to be taking the cannabis and driving. People can have disorganized thought or confusion. There is a possibility of some people being paranoid and have agitation. So sometimes people that have some sort of a severe generalized anxiety, the cannabis might not be the best for them, but some people do find it, actually it helps a little bit. And some people do find it when they do take the CBD and THC combination, they actually works much better for them. The CBD tends to reduce some of the negative side effects from the THC. Obviously, this is for people that are 21 and over. There's been reports of affecting the developmental brain. So people that are young teenagers and stuff, they're having your brain typically develops until you're about 23, 24. So anyone under 21, we don't recommend them using it. Obviously not during pregnancy. There's been reports of low birth weight, and also mothers that are breastfeeding, because it does pass through the breast milk, and it can affect the brain development. So the American College of Gynecology and Obstetrics definitely recommends not using any type of cannabis if you're wanting to get pregnant, or if you're pregnant and breastfeeding. There is also a little bit of a report of dependence. So some reports up to 9% rate of dependence. I think this number could be a little bit elevated. In some studies, they talked about how people would rather go into a rehabilitation program than get incarcerated. So they actually were categorizing these people as dependent on cannabis. And there's some drug-drug interactions, so we have to be careful with that a little bit. So let's just go to some strains. So I did some research on the internet as well myself, because obviously there's no scientific data on this. I used several sites. I think Weed Maps and also Leafly, they both have very good information, and I think the combination has worked well. Sometimes some has more information on one strain than versus the other. Again, so these are all based on patient reports, so there's no scientific data. And so we'll talk about the THC component, which is the psychoactive component. A lot of people describe a sensation of euphoria, relaxation, and help with pain relief from this. And this CBD, which is the non-psychoactive component, this people have used for pain, nausea, headaches, also a variety of other ailments such as stress and anxiety, and obviously the medical prescription for it is for seizures that people use, especially in children, which they have a specific type of seizure that's not responding to other medications, and pure CBD has worked well for them. So so these are in no particular order. Again, I'm sorry, I know you guys can't see the list, so I'll go over them. I actually had the breakdown of the hybrids and which mother plants they came from. But the first one is sour diesel. So what I'll do is I'll say if it's a sativa or an indica, or it's usually a hybrid anyway, but one type probably outweighs the other. Before actually going to the strain, I think one thing to keep in mind is, like, when you want to start on something, I think the most important thing is try to figure out first of all, what are you trying to treat? Second is, are you going to be using it during the day, or are you going to be using it at night? And how would that affect you functioning during the day and at night? So if you're trying to use it for pain, I think any type of, and during the day, any type of sativa or plant that has, or strain that has a higher sativa than indica ratio, I think that would be probably ideal. Most likely people that are novice to this or have not done much marijuana, you probably want a very lower percentage of THC, especially during the day, because you want to function. Um, and at night, you can always use the indica. At night, you could also use the higher THC level, because quite often you're sleeping, so it does not affect. And if you feel quite like a sort of a high from it, then you're already sleeping it off, and hopefully that helps with your pain. So going back to the main ones that I've found here. So sour diesel, again, sativa, it's 18% THC. Again, these are, I mean, every dispensary that could be carrying these, you just look at the percentage of their THC. So this is on average is about 18%. So this is not for a beginner, and most people use this for pain relief. Again, being sativa, so most likely during the day. Another strain that's quite popular is the Ringo's Gift. This is almost a pure CBD. It's a 24:1 ratio, and it's 12% CBD. So a lot of people use this for anxiety and pain, and this could be used any time of the day. Pennywise is an indica main strain. It's a 1:1 ratio of THC and CBD. It's about 8% of THC and CBD. And people quite often use this for pain and anxiety, and you could use this at night because it'll probably help you with sleep as well. White Widow is an indica based, and again, this is a pure THC. It's about 17% or so. It does help with the pain, and you can take it at night because it's an indica based, so it should help you with anxiety and sleep as well. ACDC, this has been around for a long time. It's a sativa. It's a 20:1 ratio of CBD to THC. So this is, again, quite good for pain and anxiety. It's a sativa based, so you can take it during the day. We have also Northern Lights. This is an indica, pure THC, about 16%. So again, at night for insomnia, relaxation. Again, it does have a lot of THC in it, so you gotta keep that in mind, especially people that are new to this. Sour Tsunami, sativa based, about CBD and THC about 12% CBD and about 1 to 2% THC. So again, much higher on the CBD level. These are the strains that I actually tell my patients. Quite often, I don't name the strains when I talk to my patients. I just tell them, look for something that has a high CBD to low THC, especially during the day. And then obviously, if you want to have a more of an equal ratio in the evening, that helps with pain as well. Another one is the Afghan Kush, indica based, pure THC, about 16%. They use it for pain. There's a Master Kush, and again, some of these are probably not available in all the dispensaries, so you guys have to do your research on that. And again, I think a couple of those websites you can probably go on and find out about them. Master Kush indica, so kind of like the Afghan Kush, pure THC, about 18%, and that's great for sleep. Canasu, which is a canatonic and sour tsunami hybrid, and that has a CBD and THC about a 9% to 5%. And again, this one is good for pain and anxiety. It's a hybrid, so the indica and sativa is probably very similar. I could not find an exact breakdown of some of the strains of the Canasu that I was looking for. Harlequin sativa, it's a CBD THC ratio of about 9% CBD to 5% THC. So again, a little bit higher on the CBD, sativa base. So during the day, it should work pretty well. And pain and anxiety, again, a lot of the ailments that people report, it's very similar. So pain, anxiety, relaxation. So quite often these are what people are looking for. Especially with the indica, again, for the evening. So obviously it should help with sleep. And and anxiety and relaxation, and then during the day, hopefully with pain and allow you to function and people go to work and do what they need to do. A few other ones. There's the Stephen Hawking Kush, and this is a pure indica. Actually, it's more of an indica, not a pure indica, but it's pure CBD, pain and anxiety. Again, as a physician, I always tell patients try it out with the CBDs. Obviously, as people know, there's a huge stigma with cannabis. So when patients, and even at the beginning, like patients were always a little bit afraid to talk to me about it, because I think what the experience they've had from other physicians is that, oh, if you tell them you're smoking cannabis, then they're going to fire you from the clinic. They're not going to be your pain meds. And I always have the discussion with my patients. I'm like, okay, what are you doing, or how are you using it, and try to see if we can educate them on at least if they're going to use it, on a better way of using it, and see if it's helping them, and then those people that are interested, try to get them to, again, it's not for everyone, but I always tell people, so narcotics not for everyone either. So if this can help you alleviate some of your pain and anxiety, I mean, better than benzodiazepine, better than Xanax and other medications that you can get addicted to, much more than this, obviously. There's also, so there's a few more that I just want to mention, since I already wrote them down, and you guys will probably see the PowerPoint. Hopefully, we're going to make it available on Sanctuary, the Sanctuary Dispensaries website in the educational section. By the way, I forgot to thank Sanctuary for sponsoring this. Okay, so the other one is a Cataract Kush, and this is again a high THC. It's about 20% THC. This is a hybrid indica and sativa together, so it's usually used for pain, and then some people use it in the evening for insomnia as well. And the Harley Tsunami, which is the Harlequin and a Sour Tsunami together, Harley Sue. So that's a CBD. Again, another one that I like, recommending to patients because it's pure CBD and it helps with pain and anxiety. So those were about, I think, 14 or 15 strains that I kind of ran through. And again, I'll make sure this is available. So if people want to look at it, and again, just another disclaimer. So this is everyone's reported response and not a scientific analysis of these. So like a take-home message, so recommendation for use, again, start slow and go slow for beginners. It's not going to take away 100% of your issues, but it should help with some aspect of it. And again, it's not for everyone. Some people have, unfortunately, the opposite reaction. Some people become anxious from it, so it's not for them. I would recommend not smoking it if it's possible. There's other formulations, the oral stuff, the tinctures, something under the tongue. Also have some cancer patients that can't do it in some other forms, and they have to use a vape or suppositories or other means as well. Most of the adverse effects, again, mainly seen in new users because they're not used to how much to take, and most of it is reversible and it's short-lived. So I always tell people to just try to stay calm if you feel very high, and people that this is why another reason I recommend the THC and CBD combination, because the CBD will offset some of the adverse side effects of the THC. And what is in the future? So the future is research, and that's what I'm hoping for. Again, all these strains, to be able to research them and have the same thing that's reproduced over and over again. So once you go and you say, for example, you pick up one strain and then you had such a good results from it, you want this reliability and going back to it and getting the same efficacy. It's very important in any type of medicine. So especially this, and this should be good for the patients. It should also be good for the clinicians, that maybe you guys come back and you tell us, hey, this works so much better for me than anything else, then we can, that's another thing that we can recommend to other patients. So again, most of this work has been done by patients. So congratulations to all you guys that have actually educated physicians as well. And that's my quick talk. I don't know how quick it was, but I definitely had some technical problems at the beginning, so I apologize for that. And I will actually go to start answering some of the questions. We have, I don't know if people want me to say their name or not, but again, it's only first name. So Anna is asking, I have knee pain, so what's good? So actually for knee pain, there's a lot of topical ones that are quite effective. So I don't have any specific brands here, but I can look for some. But I usually recommend the topical ones because it actually goes to that area and it helps the specific type of pain. Most of the dispensaries have topical and THC or CBD THC combination. So we have a question, Melinda, what is the best delivery system with someone with COPD and CHF? So this is, we got to be careful with any type of inhalational stuff. Obviously, if you already have a lung disease and you have a congestive heart failure, we don't want to create any type of smoke. Anything that bypasses the lungs, I think is probably the best way to go. If you want to try something, again, probably tincture, something that goes sublingual, like under the tongue, which kind of bypasses what's called the first pass metabolism of the liver. So it gets, the absorption is better than just eating it, digesting it, which could take anywhere from 60 minutes to 120 minutes or even up to 3 hours. Okay, Bradley's asking, I suffered an ischemic stroke as well as a hemorrhage when reverting the clot about a year ago. I have severe neuropathy in my affected head and foot. Opinion regarding THC use and my brain is using my brain. Opinion regarding THC use, my brain is healing. So I'm sorry about this event. What you've probably developed is what's called a central pain syndrome. And this has a significant inflammatory response. So I think CBD could be an option in here to use in this setting. Narcotics are very bad for neuropathic pain. So I think with any type of medicine, there's again a lot of trial and error. Just because one strain doesn't work, I think we shouldn't throw out the baby with bathwater. We should try other strains as well. Just like in pain medicine, we don't just because one medication doesn't work, we don't stop there. So we try other ones. Sorry, while your brain was healing. I'm sorry, I misread it. Yeah. So again, I think CBD would be a great product to try. One thing about CBD that I do want to mention, there was a study done about 3 years ago that they took CBDs and they ordered them from online and they did testing on these. A third of them had THC in it, which was not printed on there. A third of them had a different amount of CBD than printed on it. And so you guys got to be careful with the CBD that you get. Try to get it from a reputable place, someplace. If you have to order it online, make sure to have significant amount of reviews. And I'm not talking 1 or 2 or 100, like thousands, because it's really hard to make up 1,000 of your own reviews, I think. So that's very important. And also, they should all have a certificate of analysis that gives you the breakdown of what's in there in addition to the CBD. I think that's very important. Caitlin saying, my sister has a very rare autoimmune disease and is looking for a strain that will assist the anti-inflammatory, like high humulin, terpenes, anti-nausea, and most of the pain like fibromyalgia. Okay, that's a very good question. So again, we talked a little about terpenes. There's like 7 or 8 of them that are being reported on these laboratories that do give you the certificate of analysis of what's in there. So those are very good. Again, with the inflammation, I like CBD. It's been shown to help with the inflammatory process. So I would start with that. I think a lot of people are probably sometimes hesitant with the THC. Again, if you do want to have some THC in it, which is understandable, and it actually help with the pain as well, is something that has a low THC and high CBD combination. So we have a question from Stephanie. What is the biological mechanism for topical pain relieving function that are not transdermal? In other words, since it is not accessing the bloodstream, what is the cannabis penetrating or activating that is pain relieving effect? I know topicals can be great, just wondering about the biology. So there's 2 things. So it actually does absorb through systematically. It does get absorbed into your bloodstream. So just because you put it on your knee or shoulder, and if you go do a urine drug screen, it can show up because there is still blood flow that goes to the skin, that goes to the fat that's underneath, and the tissues below. So there is some absorption there. We do have, so most of your pain receptors are in your spinal cord, but we also have peripheral pain receptors as well. Quite often, the topical actually help with the pain receptors that are on the surface of the skin, which initiate the transmission of pain. So that's where people think that some of the benefit comes from. And this is why if people are familiar with TENS units, is like these are the transcutaneous nerve stimulation that you actually put it on the site that's causing problems and gives the electrical stimulation. So it's kind of modulating the transmission of the pain signals. Going back to Caitlin, she says the same question regarding her sister. CBD gives her a headache every time. Is there strain that works with high THC? Anyone experiences with CBD? Again, maybe we start out with just the lower THC with her and see how she does instead of going to very high, unless she's very adapt to using THC in the past and she's not a beginner. Then obviously any of those strains that we talked about, anywhere from 16 to 18%, and that could be an option, and see how she does. There's also a lot of higher THC percentage strains out there, so I want to make sure we're careful. When there was a study, actually I should have just grabbed the chart, it was kind of interesting, that all the drugs that were confiscated by the FDA or the DEA, and then they did testing on it, the level of THC since I think it was like 1980s or something has significantly reduced. Significantly increased to like up to like upwards of like 25 to almost 30% this day and age. So we got to be careful with how much THC is utilized. And obviously, the higher the percentage, sometimes there's more side effects that can be seen. I think that was, let me just scroll back up and make sure I didn't miss any other questions. T mentioned something early on about that the law just changed 2 weeks ago. I think that was during my talk on the research being difficult. So I'm not familiar with what T is saying. I know they tried to make it more streamlined for researchers, but it still is quite difficult to start a cannabis research. And I think that was all the questions, unless someone has anything else. Again, I hope this was informative. I apologize for the technical issues at the beginning. It was my first time using this platform, and I thought we would be able to use the PowerPoint, which I had, but I'll make sure that it's available on the Sanctuary's website. And I appreciate everyone taking time out of their busy evening to join me on this webinar. So actually, there's a couple more questions. Melinda, how does someone participate in your trial? So Melinda, this one, so we're just getting it off. I will, if you want to, it's got to be someone that's already on opiates. And so we want to show that we're able to get people off opiates. So if you want to give me your email, and what I'll do is as soon as we get the trial going, we'll probably be doing some advertising, because even though we have a lot of patients in my clinic, not everyone probably wants to participate in this trial. So we'll probably have to make probably do some advertising to get some patients involved. So if you want to give me your email, I'll make sure I'll shoot you an email. Then you have my email. Then we can communicate that way once the trial gets going. We have Grayson is asking which strain cannabis is better for back pains and spasms. So, excuse me. So we went over about several of the strains there. So if you want to use something during the day, so I would recommend something that's more of a sativa and more of a higher CBD to THC ratio, or just a pure CBD during the day. And then in the evening, you could try an indica, and that should help with the spasms even more because it's more relaxation. So again, something that's more of an indica hybrid, or and has maybe an equal amount of THC to CBD ratio for the evening, so it doesn't bother you. And again, these are all recommendations that you guys just have to try and then kind of tailor it to yourself. So, for example, if Grierson takes something that has an equal amount of THC to CBD, and he doesn't like the feeling and the sensation of the cerebral stuff, then I would recommend something that has lower THC. So that's how we can come to a conclusion of what works for you and what doesn't work for you. I hope that was helpful. So Don has a question: what kind of strains help with MS? So MS is difficult. It's obviously it has to do with the autoimmune and also the nerve component of it. So again, with a lot of the autoimmune MS, fibromyalgia and stuff, I always tell people, if you want to try with something that has a higher CBD content and help with the inflammatory process, I think that would be a good start. And then you can always experiment with something that has CBD with THC in it. So I'm more of a conservative physician. I always tell people it's always easier to be conservative and then add things as you go along, versus going full throttle and then having a reaction, and then you'll never go back to it. Okay, so we have another question about migraines. People with migraines tend to gravitate towards harsh CBD products. 20-1 seems to be a good ratio. So again, kind of reiterates what I was saying. People with the migraines, they tend to get, I mean, obviously it could happen any time of the day and night, and especially during the day because of the sun, lights, and everything. So again, something with high CBD. We did talk about a few strains that were pure CBD, and the 20-1 ratio that Grayson is talking about. So there's a bunch of strains out there. We just have to see if the local dispensaries carry these. And again, you guys can, if they don't carry them, I think you guys are the best advocates for these. You could talk to the dispensaries and say, hey, this is what we're looking for, especially the ones that are kind of catered to the pain patients, because obviously there's the medicinal aspect of it, and there's the recreational aspect of it. A lot of people with the recreational can request something that has much higher THC level. So that's a bit of a difference. And then some dispensaries were talking about that their selection for the medicinal aspect was a little bit lacking. So again, I think as physicians and also as patients and patrons of these places, you guys can always discuss that with them. Myra is asking if I can email the PowerPoint. I'm good with that as well. So if you guys want to leave me your email, I'll be more than happy to do that. And I think that should wrap it up. So what I'll do is I'll just give you guys my email address. Then that way you guys can email me. Then I'll just email you the PowerPoint, and then once it's up on the sanctuary, I'll do that as well. So let me do this. So it's Mohajer, PMOHAJER @primemed.org. So you guys can email me, and then I'll whoever wants the PowerPoint, I'll shoot it over to you. And then once it's on the sanctuary, those people that emailed me, I'll let them know, and then we'll go from there. Well, I appreciate it. I hope everyone has a great evening, and we'll just end at this point. And again, if there's something pressing and people really need an answer to, you have my email now. You can shoot me an email. I hope you guys have a great evening. And thank you.